So here we have a patient who is 2 months out from minimally invasive surgery to heal an ulceration that was on the bottom of the foot, right in this area. And you can see now this patient is 2 months out. Ulceration is completely healed. And this right here was the stab incision to make the cut in the bone to heal this ulceration. And you can see that the incision site is very, very small, maybe 2 millimeters, completely healed. And we have the patient here today. Can you tell us about this ulceration that you had on this foot before the surgery?
I basically noticed a callus building on the bottom of my foot, and it was getting larger over time, and I had it shaved off a couple times, and it kept coming back. I eventually came in to the podiatrist to find out what the situation was, and at that time I found out that I had a diabetic ulcer underneath of the callus. When that got to that point, I was having a problem. We tried to do it with therapy first and just healing it up. That wasn't particularly working in my best interest and was taking a while. Dr. Spear suggested this surgery. I had another podiatrist suggest a much more invasive surgery. After consulting with Dr. Spear about this, he gave me access to a few studies that have been done on this surgery. I looked it up, and it had a good success rate. And once going into this, I was in and out. Was a little discomfort for a day or two, but nothing like the broken bones I've had in the past, and nothing that was all that bad. As things, I noticed day by day that the bottom of my foot kept getting better, and then it was just after a while the bottom was handled completely, and the incision was all that was left. And I've been bugging this guy, day in and day out, because I swim for exercise and I haven't been able to do that. And hopefully in a few minutes after we hang this up, he's going to tell me I can go swimming tomorrow. So I'm a happy camper.
Hey, you can go swim today. This looks great. Now, after surgery, what was the recovery like? So we let you walk on it. Did that help with things that you were able to walk on after surgery?
It was much better. I did use a cane for about a week or so. The shower, definitely recommend getting a shower bag and keeping it clear, because that was a bit of a pain. Of course, the first time you try that, you flood out your bathroom, but hey, that's my fault, not it. You know what I mean? So that's a situation. But basically, like I said, I had a broken ankle some 15 years ago, and basically had to learn how to walk again. And this, in comparison to what I went through with that, this was like a walk in the park. There was not much really to it. It was much easier than I actually thought it was going to be. I had my doubts when I went in, but I don't have my doubts now. This man knows what he's talking about, and you can call me and ask me if you want. I'll tell you what I'm telling you right now. So if this situation is going to work for you, I recommend it.